As a mental health researcher, I got into this field because I've personally struggled with mental health since I was a child. And in my own experience, as well as in my research and what I see, mental health care today does not work well. Yeah. So it's a field that doesn't have objective diagnostics. Every 40 seconds, someone someone globally commits suicide. That's every 11 minutes in the United States. And about a third of Americans live in mental health care shortage areas. Even at Stanford, which is an elite hospital, a leading academic institution, when people are discharged from the emergency room, my prior roommate was a psychiatry resident, and she told me that they discharge patients who have tried to commit suicide with a list of phone numbers for therapists who are likely not available. Beyond that, even among the people who do get treatment, the drugs don't work very well. And only about 30 to 50% of people get better from the first antidepressant that they try. But the good news, and that's why we're here today, is that there are very powerful innovations and solutions in this field. There are solutions that are working well, and there are a lot of incredible emerging innovations across what we've chosen as these 4 pillars today in precision mental health, digital mental health, psychedelics, and awareness interventions. And so you're going to hear from incredible speakers today. Starting out, Dr. James Doty, right here, will be leading you through a compassion exercise to open your heart. And he'll be speaking a little bit about the social inequality aspect of mental health. Among the other amazing speakers, we have Leanne Williams, who will be speaking about precision mental health. Nicole Bradford will be speaking about digital mental health. Lauren Packard will be speaking about psychedelics. And you'll have Byron Katie, who will be leading you through an immersive awareness intervention that our research shows to be incredibly powerful for depression, anxiety, and well-being. And this practice is one of my personal favorites, that when I'm truly struggling and suffering, like in the darkest moments, this is the practice that I personally go to. And so I'm very excited to share with you all today. Today, we have a huge opportunity because, like I said, these solutions exist. But I think the question is, how can we create a structural framework so that they can be implemented? How do we get them implemented more rapidly in clinics? How do we have them have, policymakers thinking about the correct angles, which Ben and Lauren and others will be speaking to. So we have all the right people in the room today to have these conversations and to move forward these innovations that are already working for people to help get people access to mental health care. So I know that each one of you today, you woke up, you brushed your teeth, and you came here today very early because this tells me we all share something in common, that you would come today to talk about mental health together. We all care about making better solutions for ourselves. I personally am always driven first to start with looking at my own life and to see, how can I be a better person with myself and to the people around me. We care about making a difference for the people in our communities and our friends, our families, and also trying to have effective innovations that can be scaled globally to help people around the world. So we have a chance today to connect to our own purpose, as well as to connect to each other to drive forward these incredible innovations. So thank you so much. I'm personally committed to doing that today. And I ask that every single one of you make a commitment to, number one, connect to your own truth and self today and have a personal experience of, you'll just have to see when you do the work, but it's going to be like a personal experience of humility and personal transformation. And also, I ask that you connect with one person around you and find a way to support each other in your mission and purpose and mental health. Yeah. And there's some incredible people, so that should be very easy.